Alright guys, today is my pre-op appointment. Feeling a little bit anxious. I'm not sure what to expect, but we will see. I am here waiting to get called in. My husband's in the car. We're gonna ask all of the questions that we may have before the operation. Operation will be next month. I am just going to be prepared for any last minute questions I may have, and I'm not really nervous as much as feeling a little bit anxious. I'm not sure what to expect, but we will see. Fingers crossed. Are you nervous?
No. Should that be?
I don't know. You said you wanted me to tell my parents because you're nervous.
No. I shouldn't tell my parents because it's a good idea to have them.
No, you said you wanted me to tell them because you're scared something's going to happen. By the way,
Exactly.
Oh, you have to sign.
How are you?
Good, how are you?
Hi there. Good to see you guys. I just sent your prescriptions, so get those this week. You've been on the 30 carbs and less, 30 days, perfect. You got passing grades on your exams, so great job there. Your weight is below your starting weight. That's what's most important for the insurance company. That's perfect. From now until I see you, you'll just continue the 30 carbs and less. You can have regular food. You don't have to do all liquids, just 30 carbs and less. When you get to the Saturday, your surgery's on a Monday, correct? So when you get to the Saturday and Sunday before the surgery, then you'll be on the full liquids.
Okay.
And just be prepared. There's 5 surgeons that operate in our hospital. The nurses mean well, but they can never remember what each one of us do individually. You have to do a bowel prep, whoever calls to verify everything. There's no bowel prep. So if anybody tells you about a bowel prep, just ignore them.
Okay.
Next thing you might hear is on the Saturday and Sunday before your Monday surgery is you have to do liquids, but it has to be clear, like a colonoscopy. That's not true either. You're allowed to have full liquids or you'd be starving for 2 days. You can have even 4 shakes if you want, Saturday and Sunday. And then nothing to eat or drink after midnight. All right? All right, so 30 carbs and less till I see you. The last weekend, full liquids only, no bowel prep. Now, don't assume that the world understands what it means to have a gastric bypass. When in doubt, you call us. Never hurts to call. The morning of the operation, I will see you in person, face to face. I'll ask you who's in person, have your operation. You'll go to recovery. If you lay in bed after surgery and you don't take deep breaths, you most assuredly get pneumonia and fever and so forth. So during the day, in the hospital and at home, we want you up and about. The worst part of the surgery is rotation. You can do whatever you want. You can sleep any way you want. If you want to sleep upside down, backward, or on your stomach, or where you can, but it can be uncomfortable. And it can feel like a burning or pulling feeling, especially on the one above and to the right of your navel. And that'll last a month. What? So walking, breathing, slow sipping, and icing is your only daytime activity responsibility, and you wear the CPAP at night. It's very straightforward. And next I want to draw everything out for you guys. This is the outside view. Belly button, right and left rib cage. We're looking straight down. So 12 millimeters, and 3 small 5 millimeter sites. That's the outside view. Inside view. So you have your esophagus and your stomach. We make the pouch the size of my thumb. So you have your gastric pouch, and this is your bypass stomach now. We measure the small intestine, 75 centimeters down. This is the bile side, and we make the Y. We bring the roux, and I do a hand-sewn 2-layer technique to join the pouch and the roux. This is the roux side. Opening is about the size of a dime. The food will travel 150 centimeters down the roux. It'll meet the bile side, which is traveling 75 centimeters, and then the 2 roads become 1 road. So to just know you're going to feel bloating from the fluid, kind of puffy and bloating, and your body's going to get rid of it over time. So when you wake up in the recovery, certainly by the time you get to your room and you're more aware of things, you're going to have all this attached to you. All right, so now we're at the next morning. You're in your room. Probably by the time I come, you're already back in your recliner, feet on the floor. Your numbers look good. Your drain looks good. Your urine's a nice clear color. You're drinking fine. You're out the door. But as soon as you void, you'll be able to go home. And the plan is for 1 overnight.
So the plan is 1 overnight, irrespectively of what time surgery is done.
Correct.
Least amount of time in the hospital. I get anxiety.
You know what? That's really the way we're going. We're evolving toward the same day. But I'm not there. There are people that are there already. I'm not there yet. This loss of like being proactive. Plus, for our patients, everything that you might enjoy better is not in the hospital. It's not that I'm not progressive, I am. It's just that I'm very precise and exact in everything I do scientifically. So it's just about letting that last part go. I'm not there yet. Inside you. So remember, one of your studies showed you might have a small hiatal hernia. I told you if you have it, we fix it. If you don't, we do not. I want to show you what that's like if we do. So you have a diaphragm, separates your chest from your abdominal cavity. The esophagus primarily runs through the chest, but then a portion of it comes into the belly and meets the stomach. So if you have a hiatal hernia, we'll see very likely a small portion of your stomach up into your chest cavity. That's fine. We bring it back to the abdominal cavity where it belongs, and then we close the diaphragm. Okay? So if you have that, we fix it. If you don't, we won't. At the end of your surgery, to make sure you don't have bleeding or leak, we do either an endoscopy or a leak test or both. And the drain goes around the upper part of the anatomy, exiting, like in the previous diagram, left upper side. That's the operation. You'll be told, you're lazy, this is drastic, this is dangerous, you should never do this. There's all kinds of things.
I have a friend who did it, and she's like, it looks scary, and it's funny because watching you draw everything looks like so overwhelming, but she's like, it's through the process. Like
It's a process. I mean, it's like anything else in life, no matter what people do. What you do, you do what you do for you, you're used to doing what you do. And that being said, despite the fact the surgery is very safe, and like I said, safer than gallbladder hysterectomy, there are still risks. You can't avoid that. Those serious risks, and we don't cover all the minor risks, but the serious risks are 5 things. Risk to your life, bleeding requiring a blood transfusion, leak, blood clot, and obstruction. I don't expect those things for you. You're going to do great. Your preparation's perfect. You've gotten through all your testing. We know everything about you that we could possibly know. We have the most comprehensive workup, arguably, of any surgery, period. Bring the CPAP into the building, use the CPAP at night. When you go home, do the same things, and you'll do great. Okay?
I do have to give you feedback. You're very thorough, and you have made the process very, I feel like, yes, overall it's a lot.
Yeah.
You have, like, your team has been amazing. I'm
Thank
like,
you.
hey, keep up with this.
That's very nice of you. I thank you. So just to recap, from now until I see you, don't go over the 30 carbs. Stay there. Ignore anybody who tells you there's a bowel prep. Ignore anybody who tells you it's just clear liquids on the Saturday and Sunday. You can have the full liquids. Come in ready to walk, breathe, slow sip, and ice.
Yeah, but overall.
Thank you. All right, so Nate will be right back. Thanks for your patience. And
Awesome.
any questions, just call us, okay?
Awesome. Thank you so much.
Okay.